As infectious disease experts in the U.S. assess the threat of a potentially more contagious new COVID-19 strain, we're learning more about the variant tonight. Health officials across the globe, of course, working to stop the spread of the new strain. We're joined now by Dr. Amesh Adalja. He's a senior scholar at Johns Hopkins Center for Health Security, and his work is focused on emerging infectious disease, pandemic preparedness, and biosecurity. Doctor, thank you so much for being here. I'm sorry we kept you waiting with that breaking news.
Thank you for having me.
All right, so we know this new strain is more contagious. The reports are up to 70% more contagious. But what do we know beyond that in terms of how it differs from the original strain?
Well, you have to remember that all viruses mutate, and coronaviruses, because their genetic material is RNA, mutate more than another type of virus. But most mutations don't really do much. But what we're seeing with this mutation is that it looks like, at least in laboratory studies and then kind of juxtaposing that to epidemiology, it seems to spread more efficiently. We know that it's not more serious in terms of the symptoms that it causes or the fatality rate that it has. And we also know that the same common sense measures of washing your hands, wearing a face covering, avoiding crowded and congregated places are going to stop this strain and any other strain. And there's also no evidence that our vaccines are going to be ineffective against this strain.
Doctor, does this new strain provide an obstacle to the United States finishing this pandemic? And I ask because should Americans worry about this latest strain?
I don't think the general public needs to worry about this strain. If the general public is doing what they should be doing with the hand washing and face coverings and crowded and congregated places, this strain won't be able to transmit. I do think it's important for scientists to understand and track this strain to understand how mutations occur and what those mutations do functionally for the virus. But in general, the same message applies to this strain as to other strains. We have to continue to really move forward with all of our social distancing and those types of measures, and that will halt the spread of this strain. And again, the vaccine is going to be something that will put this pandemic behind us, and it does look as if the vaccine will be effective against this strain.
So is it possible the new strain is already here? It's shown up on 4 continents already. Is it possible it's here in the States and just hasn't been detected yet? And also, I'm wondering how scientists and health providers actually screen for it. Does it show up on the average COVID test and then let you know that it's a different strain?
I would say it's certain that this strain is already in the United States. You have to remember that we don't do that type of sequencing. Basically, we test people, but we don't actually analyze the virus, and that's what you need to do. It's not just a normal test that's going to tell you this. This is a more sophisticated process where you actually look at the actual genetic sequence of the virus, and we do that on a very small number of our cases versus what the UK and South Africa do. So it likely is here. We just haven't detected it yet, and it shouldn't be surprising, although it will be breaking news when it occurs, but I'm sure and certain that it is here. And again, it's something that we have to continue to do what we're doing for to keep it at bay.
Dr. Adalja, you mentioned this earlier, but I want you to hit on it again about the vaccination process with this new strain and the worry that as we wait for a vaccine and new strains are emerging, that it is quite possible, if not probable, that the vaccine will actually work against this new strain.
Right. So most of the data that we're seeing, and Pfizer, Moderna are doing studies on this specific strain and their vaccines, show that the antibodies generated, and remember, it's not just a single antibody that gets generated by a vaccine, but a whole bunch of antibodies, as well as what's called T-cell immunity, which is a whole different arm of the immune system. All of that is going to be robust against this strain based on what we're seeing so far. It takes a lot for a virus to be able to evade a vaccine, and it's not something that happens very simply or easily. So I suspect that these vaccines are going to be effective against it. I got my vaccine last week, and I'm confident that it will protect me against this strain.
Dr. Amesh Adalja, we appreciate having you. Thank you, as always, for your continued education about the virus.